Thanks for joining us today, Zoe. We've had a full consultation. We've gone through your medical history. Tell us, how can we help you? What are your main concerns?
So since having my little boy, I feel like my whole face has dropped to the point where I didn't even recognize myself in the mirror. And so, yeah, I feel like it's just I've got jowls hanging around my mouth, just aging, looking tired, are my main concerns.
Okay, very good. And we've talked about a bit of a treatment plan, and we're going to do this over 3 different stages. So the first thing we're going to do is try and target the things that happen with the aging process, and that's restoring the volume that's been lost in the deep fat and the bone. So that's going to be up in the temples here, the apex of the cheek where the suborbicularis oculi fat is, the deep medial cheek fat, and the deep pyriform space where we get maxillary resorption. Down in the gonial angle where there's some resorption of the mandibular angle, and in the chin here. If you just turn your head that way slightly, we can see that really beautiful cheekbones along here. So the zygoma is well projected, but with that, we've got some hollowing up in the temples, and we can see some flattening just on the apex here and here. If you turn your head all the way that way there, and we can see that the chin is actually really nicely projected with a little bit of loss of volume anteriorly relative to the nose and the lips. So we're going to start with our deeper treatments today. Then in a few weeks' time, we'll bring you back. We can do some biostimulating treatments to get the skin as elastic as possible. And then in a few weeks after that, we can do some finishing touches with some filler. How's that sound?
Great.
Perfect. Awesome. Let's do this.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
We're going to be drawing up our marking points first, and then we'll move on to our injections. As always, we're going to be starting superior to inferior, lateral to medial, and then deep to superficial. As I mentioned today, everything that we're going to be doing is deep, and all of the injections are going to be supraperiosteal boluses. So let's start up in the temple. In terms of our temple anatomy, we've got to think about its boundaries. So we've got its superior or cranial border, which is the temporal crest here. Its anterior border is the lateral portion of the orbital rim, down here. The inferior or caudal border is the superior aspect of the zygoma. And then the posterior border is the hairline here. So we've got some diffuse hollowing here, but the first thing I want to do today is focus on this superomedial aspect, which is our one up, one over, and we're going to be targeting the deep part of the temple. I'm just palpating, seeing if I can feel any pulsation of the superficial temporal artery, which I can feel posteriorly well out of the way of our injection. And I can't feel any deeper pulsations here.
So Max, for any new injectors watching, can you just go through that one up, one over landmarks?
Yeah, so once we've found our borders, and this is why it's so important to really palpate the temporal crest and the orbital rim, we're following up our temporal crest up 1 centimeter and then dropping down 1 centimeter, which gives us our injection point just here. Because of the temple being what we consider to be a higher risk zone where we have anastomoses with the internal carotid circulation, as always, we're going to be doing our slow injection aspirating. But here we're going to increase the sensitivity of our injection by using a 25 gauge rather than a 27 gauge needle. It's as comfortable, but lower risk. Let's come a little bit more inferiorly now, and we're going to be focusing on the apex of the cheek. The apex of the cheek is an aesthetic point and not an anatomic point. That being said, like everything, it aligns with something that is a true anatomical target. And for the apex, that will be our suborbicularis oculi fat, or our SOOF. How we find this is by looking. It's an aesthetic point. We're finding the bit of the cheek that is most projected or needs the most projection there. And I can see that quite clearly as being this point just on top of my finger. If when you're getting started, you need a little bit more guidance with it, then a really good way of finding it is by, again, feeling for the orbital rim. So we're palpating the medial border and the lateral border. And then we'll be drawing a line straight down from there. And again, once you've got this line, you should be able to see the point that needs the most projection by pinching and pushing. And I can again see that's right here. If you're still struggling after that, then we can draw a line out from the alar of the nose horizontally across. And where these lines converge is almost always going to be the apex of the cheek. For women, that's going to be a little bit more lateral, a little bit higher. For men, a little bit more medial and slightly lower down here. If you make these lines and it still doesn't look quite right, then sit the patient upright, look from a slightly different angle and see where you want that projection to be. Staying lateral, but coming down, we're now looking at the mandibular angle, often called the gonial angle. And we can see here already, there's really nice definition when Zoe's got her head turned to the left. And we want to be drawing on the ramus and the mandibular angle there. Our injection point here is going to be deep and a centimeter in from the angle there. This is a really interesting injection because although the target of our needle is the bone, where most of that product is going to be sitting is actually within the bulk of the masseter itself. This is where it's going to give us that projection and give us that support. We know that if we relax the masseter muscle too much with our neuromodulators, it can lead to some heaviness in this area here. So we're doing the opposite of that. We're adding volume to the mandibular angle and the masseter and helping to provide that deeper support and structure to add some definition along the anterior part of the jaw. Next, we're going to be looking at coming even more medial at the deep pyriform space here. A good way of assessing the pyriform space is actually just by pressing down here. If you feel that when you're pressing down, your finger there's no support underneath it, it's a sign that the maxilla has resorbed somewhat and you've lost the support there. For this injection, we're going to be targeting where we can see this slightly shadowy triangle in the corner of the nose here and injecting right down deep there. With this injection, again, super important to be deep. We've got the facial artery that runs from the anterior border of the masseter, gives off branches to the lip, the superior and inferior labial artery, and then typically runs superficially up in the nasolabial fold. So we want to stay medial and deep to avoid the risk of that. Of course, we will always be aspirating, but we want to make sure that the injection is safe and the aspiration is a final check on that. And then finally, we're going to be looking at the chin. So chins are expressions of sexual dimorphism as well. And we need to be really mindful when we're adding volume to the chin that we're not making it look wider than it should. If we have a female patient, we make the chin look wider, we're going to make it look more masculine as well. So we want to be mindful of keeping the width of the chin within the width of the nose, and at the same time not over projecting. So we'll be finding the midline here and looking from the side, seeing where we want that projection, which is that antero-inferior injection that will provide that support and give the mentalis muscle something to contract over, and add some lovely support again to help add some definition and support to the jawline. We'll be doing posterior support and anterior support. So I'm going to be starting in the temple. We've drawn on our marking point here, which is our 1 up, 1 over. The target for my injection is the periosteum. I'm just stretching the skin very slightly to see if I can see any small little veins anywhere, which I can't. And give it a sharp scratch in 3, 2, and 1. Well done. Normal to feel some pressure here of the patient. I can feel layer 5, our periosteum. I'm aspirating with my 25 gauge needle, which is unprimed, for 5 seconds. I'm doing a nice slow injection. All the while, I'm watching the skin and seeing how the temple fills. Slow injections are important everywhere to reduce the risk of product displacing into areas we don't want it to go to, but also from a vascular perspective, the slower the injection, the safer the injection.
And it's worth mentioning there's things here we can do to actually also prevent the filler from spreading too close to the surface of the skin. You'll notice that Max is injecting at a little bit of an angle, and in the temple we have multiple complex layers, but it's been shown on studies that if the needle goes in at a steeper angle, like 45 degrees or even 90 degrees, then you're trapping the filler beneath deeper layers of fascia. And in the temple, you have the deep temple fascia. And so coming in at a 45 degree angle in the temple is something that can help to prevent filler from spreading too close to the surface.
The nice thing in the temple is that even as you're injecting, you can see it being revolumized. And now that I've come out and I'm just gently massaging, checking the capillary refill, we can see that the temporal crest and the lateral orbital rim, which was quite obvious before, has softened fairly significantly with not a huge amount of filler. And the tail of the brow on this side is also very slightly higher after that injection. So next we're going to come down to the apex of the cheek. I'm going back to a 27 gauge needle for this. So again, it's a layer 5 injection. The area that I've marked up is that on that boundary between the medial and the lateral souph.
I like there how you squeeze the skin as well to increase the tension on the skin, so you can inject through it much easier, but then you have to let go, so you shorten the distance between skin and bone once you're through the skin.
Absolutely. I see that quite a lot when teaching people who haven't done a huge number of injections. They get the skin under tension by pinching, then they realize they've used the full length of the needle and then can't find layer 5. So it's that balance between traction, but then also relaxing your skin. And this is an area where we really do want to minimize product displacement. If we find that product is coming too superficially, particularly a high concentration hyaluronic acid, in an area that's prone superficially anyway to fluid retention, then it could cause undue swelling, puffiness, and probably achieve the opposite of what we'd like to do. So the cheek apex, and you can see in the oblique, is really high impact. We don't need, rest back again, a huge amount of volume to have a big impact here. So if you've got a patient coming in, you're not 100% sure what to do, you can see some flattening there, the patient's only really got the budget for 1 milliliter of filler or 1 syringe of filler, then this is a high impact place. They're going to see good results. and then you can build on that. So now we're coming down to the gonial angle. Again, like I mentioned, this is another layer 5 injection, but most of the product will be going into the masseter muscle. And again, feeling along here. Sharp scrunch. Hard. I can feel layer 5 there. Aspirating for 5 seconds. It's worth warning patients that for the next couple of days after this treatment, because we are on the muscle, it's normal if it feels quite tight and a little bit achy when they're chewing.
And this injection is helpful not just to create the definition, but also it's creating some lateral tension across the jawline, and so it's going to help to improve that sense of lower face soft tissue descent as well.
How's it feeling so far, Zoe?
Fine.
Good.
A bit more painful.
So after every treatment area, I like to check the skin. You can see that it's lovely and pink and well perfused. And we can see a really nice definition along the jaw here. It was already nicely defined. And turn it all the way towards me. Thanks. So compared to that side where we can see it's a little bit of blunting, you turn that way, it now looks a bit more structured. And you can see this beautiful line across the jaw. And that's me. Now, finally, on this side, we're going to be targeting the deep pyriform space. This injection is always a little bit more on the uncomfortable side. I'm going to clean here. We've got nerves from the infraorbital foramen, which traverse inferiorly to supply the upper lip. So again, quite normal to get some reduced sensation in the upper lip for about half an hour afterwards. I'm pulling laterally. We know that the facial artery in most cases runs superficially in the nasolabial fat pad. So by pulling back here, I'm pulling that out of the way. I'm staying nice and stable. You can feel a sharp scratch here. Odd. Feel layer 5 there. I'm using a 25 gauge needle to increase the sensitivity of my aspirate. 5, 4, 3, 2, 1. And really nice slow injection whilst keeping an eye on the skin.
So here we're using a larger needle, just like in the temple, and that's because if we have a larger needle, we can increase the likelihood that we'll get a positive aspiration. Aspiration is known not to be particularly sensitive, and that means that even if we were in a blood vessel, if we have a small enough needle, or other factors, for example, there being filler in the needle, then when we pull back on the plunger, it might not show that we're in the artery. So it's not a sensitive process, but we can do things to improve sensitivity. And so if we are going to be aspirating as one of our checks of practicing safely, then having a larger needle will increase the likelihood that your blood will flow up the needle into the syringe, and that is therefore one of our safety measures when we're injecting these high risk zones.
Someone asked me the other day why we don't do that for everywhere, and they make a good point, but we're always trying to find the balance between comfort, bruising, swelling, and safety. And
yes,
we know that in certain areas, like I think Zoe can attest to the fact that one was a little bit pinchier with a slightly bigger needle, but we know that the benefits of doing that outweigh the risks of some discomfort and some swelling. But in other areas, that's not the case, or we can have that discussion anyway. So finally, we're going to be treating the chin. If you tilt your chin up very slightly, that's great. I'm wiping the mark soft, so I don't want to be injecting through my pencil. I'm going to be doing a single midline injection. The chin is known to be another slightly higher risk area. So I'm using a 25 gauge needle again. When you're using a firm product like Rev&S Shape, it can feel quite tight here. I'm applying some pressure just above my injection point to reduce the spread of the product superiorly.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly.
Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix.
GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics.
Join us in setting a new standard for safety and results.
Okay, so we are halfway and a little bit more with the chin done. So let's have a look at where we are so far. So do you mind sitting forwards again, please? And then straight up into the camera up there. Perfect. So we can see, starting superiorly, we've got the temple and a lot more full with less shadow on this side here. The apex of the cheek is best viewed in the oblique, so we can see there's that slight flattening on the apex of the cheek just underneath my finger, whereas on this side here we can see that we've got lovely fullness there. Coming back to the middle, I would say that the nasolabial fold, even though we haven't actually treated it, on this side here has softened, and including this perioral line compared to the other side. And then finally down in the jaw, really, really lovely contour compared to still lovely contour, but a bit more blunting on the left-hand side. So when we're thinking about the signs of aging, which this lower face heaviness and nasolabial folds, we haven't treated any of those things directly, but by treating volume loss indirectly, restoring deep fat loss and deep bony resorption, we can reduce, if not eliminate, those signs of aging. How did that all feel, Zoe?
Yeah, it was easy.
Okay.